Assalamualaikum and a very warm welcome. Welcome back to our part 2 of Matters of the Heart with Sinar Daily Life and Style podcast with me, Dr. Nurhamiza Zulkifli, as your host and your moderator. So in our previous episode, we have heard from the man himself who underwent 2 bypass surgery, Tun Dr Mahathir Mohamad, a story of courage, resilience and also unwavering discipline. A reminder that even the strongest heart needs care and that recovery begins with relief. But behind every successful story stands a team of dedicated healers, and at the heart of Malaysia's cardiac excellence, none of the less is the Institute Jantung Negara (IJN), a world-class institution that began with a vision and today continues to save thousands of lives every year. And I'm so proud to be here. With me, I have Professor Dato Dr Ezani, Mohamad Ezani Taib, Chief Executive Officer and also Senior Consultant of Cardiothoracic Surgeon in IGN. In this part, the second part, we would dive into in terms of more technical matters, in terms of the medical aspect of cardiac surgery. So thank you so much, Dato.
You're welcome. Assalamualaikum.
So we will uncover how far cardiac surgery has come from, I think we have discussed about it the previous episode that Tun Dr Mahathir Mohamad mentioned that those days there was not even, IGN was not there yet. And then from open heart surgeries, then we have minimally invasive surgeries, and more importantly, what Malaysians can do to protect their own hearts before it's too late. So let's dive into the matter per se. So Dato, I'd just like to ask, we often hear of people who look healthy, and most of them they are young, but suddenly they suffer a heart attack or probably sudden cardiac arrest. So maybe what are the early warning signs that sometimes it's already there or subtle, but they tend to ignore it? So maybe you could share in terms of the red flag signs and symptoms that the patient should not ignore.
Sure, Riza. So first of all, thank you very much for having me here today. It's a real privilege. I think yes, because I've been with this profession for the last more than 30 years, and I've seen the changes that has happened both from the patient perspective and from the technology perspective. And I think first of all, with regards to younger patients getting heart disease, yes, I think that's the truth. Okay, the reason, well, you mentioned about why they look healthy, but they get a heart attack, right? So, well, looks can be deceiving, as you know, right? Yeah. So the thing is, most important is what do they have with them in terms of both genetics and diseases, right? So and lifestyle. So what you cannot avoid is your genetics. So if you carry genes that have got higher risk of coronary artery disease or heart disease, then unfortunately you will have it. Yeah. Secondly, males are more prone than females, right? So you're lucky, right? So then that's the one that you can change. But the one you can change would be those that lifestyle. No exercise, you should exercise. Smoking, can stop smoking. Food intake that you can cut down, right? Then the diseases itself. So if unfortunately you have diabetes or hypertension or high cholesterolemia, then you should manage that and make sure that you take care of it well. So like in IGN, we have a new clinic that goes for reducing risk factors, right? So if you have diabetes, the idea is to prevent getting complication of diabetes. So the red flags are those factors. If you have those issues, then you should be cutting them one by one. So if you're smoking, stop smoking. If you're not exercising, exercise and so on. Yeah.
Okay, right. But sometimes we can see there are people who are actively doing marathons, and then suddenly they just collapse during the event itself. So could you just
I think so on that note, that's a bit different. So these are people who've been exercising and suddenly, unfortunately they die. Recently, as you know, at the recent school event, which was a rugby event, and there was one young boy that passed away on the field. Now the thing is, that's why health screening is very important, right? As early as 30 years old, you should start screening already, especially if you want to get involved in sports, and especially if you have risk of family history of dying early in a high risk. Yeah? So that would be something which you have to be careful. And I think is identifying whether you have any heart pathology. Common things, which is in those that die, sportsmen especially, is when they have their heart muscles are enlarged, right, or we call it HOCM, obstructive cardiomyopathy, right, and also if they've got arrhythmogenic features, which means that they can get arrhythmias easily, right, and these are the people that you will need to do actually some basic tests should be able to identify. So we encourage those that want to take up sports or doing rigorous sports that they should be screened.
Okay, so that is something new. I mean, because most of the time people would have this false perception that if they are healthy, they are working out, they are good. But actually, before you actually embark in those extreme sports, I mean, or the heavy sports, you should be screened first. Yeah. Okay. Right. So going back to in terms of the bypass surgery and also heart attack. Okay, as we all know that in this modern cardiology era, stenting is often seen as the probably simpler options.
Yes.
And then because last time those days, I think maybe decades ago, if you have heart attack, then surgery is the goal number one. I mean treatment. But nowadays we have stenting have slowly not I wouldn't say replaced, but it's another option. But bypass is still considered the gold standard in some of the cases.
Correct.
Okay, which is they are much more superior as compared to stenting. So maybe you could elaborate in terms of what are the patients which is suitable for stenting, or which one they should go for bypass surgery. Shouldn't really try for stenting actually.
Okay, so we know for a fact that, as you know, in the heart there are 3 main blood vessels, right? So the more, in principle, the more blood vessels that are blocked, is more towards surgery. Okay, so if you have a single vessel that is blocked, then perhaps stenting or ballooning is the treatment of choice, or even 2 vessels. That's number one. So I think the most important thing is when you have a heart disease, you have had a coronary angiogram done by a cardiologist, you need to ask a few questions, how many vessels are blocked, and whether it's amenable to PCI or stenting or surgery, and sometimes some things can be done, but whether that is the best thing to be done. Yes, surgery is the gold standard, especially for triple vessel disease, disease with left main stem disease, and those with diabetes. So those sort of conditions, surgery carries a better option. Second thing is the nature of the blockages. So if it's a diffuse disease, that means the blockage is almost the whole length of the vessel, surgery is a better option. But if it's very discrete, then perhaps stenting is better.
Okay.
So it's best to have actually a multidisciplinary team discussion, right? And maybe you want a second opinion rather than straight away having whether if somebody offers you straight away surgery, you might want an opinion of whether stenting can be done.
Okay. So it's not. I wouldn't say like which one. I mean, of course, you have an option between stenting and also surgery. But like Dato Ezani has mentioned, it depends on how many vessels are actually blocked, and whether the disease or the whole vessel are actually diffused with the disease, or also in certain group of patients where they are diabetes, so surgery would be probably would carry a better outcome as compared to stenting. So you mentioned early part before the podcast that you have been in this fraternity for 30 plus years, right?
Yes, I've been doing this for 30 plus years, correct.
So you've been performed countless heart surgeries, of course, over the years. And how has the experience evolved for patients today as compared to decades, like a few decades ago? I mean, are the surgeries now, because maybe the acceptance of the patients nowadays is a bit better as compared to before? Is it because the technology, it's safe? I mean, it's much more safer nowadays because it's more common that we are seeing patients undergoing bypass surgery nowadays, right? So maybe you could share what's the difference between those days back then and now?
I think experience first. So when I first was exposed to cardiac surgery, I remember one bypass surgery used to take the whole day. You start from 7 in the morning and finish at 5. And it felt really complicated and difficult, and time consuming. But over the years, that's down to maybe 3-4 hours. Some are even earlier. But what has changed a lot is, of course, the general anesthesia, the intensive care management, and our understanding of patients' behavior after cardiac surgery. Okay, like for example, the case I did today, a patient had a mitral valve repair done, right? Okay. In the past, right, the patient would be brought to ICU, would be on the ventilator for maybe almost 12 to 24 hours and extubated only or removed from the ventilator until the next day. In this case today, the patient was extubated immediately on arrival to ICU. So that's the ERAS, the early recovery after surgery. So we do that now, and it's something which you won't be able to comprehend if it was like maybe 10 years ago. To see a patient straight away extubated after surgery. So things have changed. Our anesthetists are far better now, far better equipped, more knowledgeable. Surgery-wise, it's the same. Surgery-wise, it's the same. You do the bypass, it's the same. But taking care of the patient, that's what's the main difference. And I think experience, a good team of nurses, paramedics, and of course the doctors, that makes the main difference here.
All right. I am actually quite shocked because I was a cardiothoracic medical officer for almost 4 years. Normally, post-operatively, what Dr. Ezani has mentioned, usually will keep the patient ventilated. I mean, they have tubes for at least 12 to 24 hours, and then once everything is okay, parameters are okay, then they will be extubated. But I'm quite surprised that he said after.
Even for bypass surgery, you do that now. Yeah, that's
Wow.
quite common. Yeah.
Yeah, and last time was a long hours
Yes,
surgery,
that's right,
and I think tomorrow Dr. Ezani, he has meeting in between. He has operation and he has meeting after that. I am like, wow.
Yes.
Okay, so I just want to talk about some misconceptions that the patients might have because many Malaysians still fear of the heart surgery. Although like now you have mentioned regarding it's actually faster. I mean the teams are much more well equipped. They have we have advanced in terms of now we have the enhanced recovery after surgery. But some of them are still worried because they feel that surgery is the last resort. So how do you actually reassure your patients? Because sometimes some of them are still reluctant. They keep on coming, giving TCA again and again, but they still haven't come up with the decision for surgery.
Well, actually, the most important thing that, as you know, is explaining to the patient, right? So most of the time, they think that after cardiac surgery, they will be bed-bound for weeks, and they cannot do their daily activities. So when you explain, it's very difficult for them to even actually imagine that on the second day after surgery, they are already doing their exercises, walking, and they have to go to the gym. In IGN, they have to go to the gym on day 4, right? So they actually go down from the ward to the gym, do their treadmill, or they do their cycling especially, right, exercise. And it's a requirement. So when they hear that, then they realize that, hey, wait a minute, this is almost like nothing now. You know what I mean? Of course, there's risk, and we will always explain the risk. There are some patients that are low risk, there are some are high risk. Some patients will not be able to have a quick recovery. We know, especially those with a poor heart or many risk factors. But in essence, when we explain to the patient, and in Nigeria we have what we call a pump talk, if I'm not sure you remember. So the patients will be shown videos of how the recovery is like and how the ICU is like. So when they see it, they have an understanding of what happens to them.
Okay, so that's the most important thing for those, I think, medical professionals is how you counsel the patient. I think not only in cardiac surgery, in any surgery, surgical fraternity, is how you counsel to the patient. Of course, you have to tell them the risk and the complications, which, of course, cardiac surgery, any type, whether it's bypass, whether it's valve surgeries, are all major surgeries. But it's our duty to explain to the patient, to make them understand regarding the risk and complications, and also the advances that now we have all this. You can actually get extubated after the surgery. A day 4, you're supposed to go for your exercise. So more or less like something you like a normal other surgeries as well, right?
Correct.
Okay, so talking about that in terms of the patient per se, just want to talk about in terms of the family support system. We know that we often say recovery takes a village. How crucial is family involvement in helping a patient to recover successfully after heart surgery? Because sometimes there are patients that the patient wants the surgery, but the family are a bit reluctant. But you also have patient who doesn't want surgery, but the family are trying to push for it. So what advice would you give to the family members to support this group of patients?
Okay, so when I see the patient in the clinic preoperatively, I always insist on having a family member there, so they also understand what the patient will go through, what are the expectations, how many days they will stay before surgery, after surgery, how the patient would basically look like after surgery and things like that. So I'll tell them that sometimes there's a tube in the mouth, sometimes there's none. They will have many tubes on the chest, so that helps make them understand a bit better. Yeah, and of course we have counsellors to help explain also in IJN, to help explain, to provide them with support if they need it. And I think, but all in all, family support is extremely crucial. So because for the patient, after the surgery, if they're family members, they recover better. Tolong ambilkan makan, things like that. So they can talk to, and actually they feel better when they can talk to the family members, simply because they feel normal again. So they are always uncomfortable if they are left alone. So family support is crucial. Yeah.
Okay, so to all those whoever has family members who has been diagnosed with cardiac issues, for example, who has blockages, please be very supportive to them and be with them most of the time. I mean, that is very important because they need to recover with the support from their family members. So talking about recovery per se, so we know that recovery doesn't just end with the surgery. Most of the people, they understand that, okay, once they have graft, I mean, like for example, you have underwent a bypass surgery, they will take a vein graft and replace it, and do a bypass surgery, and then they think that they could go back to who they were before in terms of their old habits. Because sometimes you can see patients prior to surgery, they say, okay, I've already quit smoking. Correct. But after that, they go back because they feel they're good. So they go back to their old habits. So what are the key adjustments that patients should expect in their life, especially in terms of diet, exercise, medications? Most of them will have a long list of medications, right?
Correct, yep. Okay, so yes, no doubt that if they have risk factors, first identify what's the risk factors, before that. So after surgery, once they're out of ICU in the ward, first of all, they'll be seen by our dietitian, physiotherapists, and all that, to explain about diet, about, exercising, what to exercise, and of course, they should not smoke. Now, the problem is that they follow this for the first 3 to 6 months. Usually no problems. The wife will be careful, the patient will be careful, but once the pain is gone, once they they can't see the scar anymore, they forget, right? Yeah, and it's not uncommon. You'll see them smoking again, or not controlling their risk factors, their blood pressure or diabetes, and sometimes it's frustrating to re-explain to them that, look, you just had surgery last year, and if you're not careful, the new grafts will get blocked early and things like that. So no doubt that explaining is important, but the guilt, the guilt.
It's very stubborn patient.
The guilt, that's right.
Okay, so you were telling us regarding that it can get blocked again, because maybe some of the patients out there, they have this perception that once they have a new graft, I mean, it's like some sort of like a new heart.
Yes,
I mean, so it will probably never going to get blocked again. But is it very common for you to get?
Okay, so what I do explain is that, look, if the main thing is to reduce as much risk factors as possible. So if you are a smoker, you've got diabetes, hypertension, high cholesterol, right? So first stop smoking, that reduces one risk factor. If you have diabetes, make sure that it's well controlled. And so goes for hypertension and so on and so forth. So if you try to normalize those risk factors, then you should last, the graft should last longer. If if they are not normalized and they are high or sugars are high, then it will just come back earlier.
Yes, so that is very, very important to all the patients out there, or the future post-operative patients, cardiac surgery patients. It's very important that once they have so-called repaired or probably cure your disease, you have to really take care of that. Because first and foremost, cardiac surgery is not easy. It's a major surgery, and it does not come without risks and complications. So once it has been you have a new bypass graft, so you're supposed to take care and try to stop all the unnecessary or unhealthy, I would say, habits, right?
Correct.
Okay, so as we all know, we're talking about dietary habits, our sedentary lifestyle. But we know Malaysia is a hardworking nation, so we have long hours, long stress. I mean, like we have high stress, little sleep has become some sort as a norm. I mean, to have to sleep like 3 to 4 hours. Even if you're at home, also you have to work from home. So what advice you give to patients in those who have very demanding jobs, even like as a doctor itself, on protecting their own health? And how do you personally manage your own stress and heart health? I know that IJN team, they are very, very active. They go for sometimes cycling, and they look out for their heart. But maybe you could share.
Okay, I think first of all, whatever work you choose to do or your occupation, you must enjoy it. If you find that your occupation is a chore, then you should change it. Because if you enjoy your occupation, then the stress level will come down, right? No doubt there will be occasional stress here and there, whether you're a doctor or you're not a doctor, right? The second thing is you must have good family time, okay? With your family, your children, pets, I think that's a good way of releasing stress. And I would encourage people to be involved actively in the exercise lifestyle, okay? Like in IGN, this week is our volleyball competition. So I play volleyball. So like yesterday we had the tournament and it will go on today, tomorrow, So the week before was badminton. So we frequently have this sort of programs to promote healthy lifestyle, not just within IGN, but of course, like this Saturday we are promoting with the RHB Banking Group, right? Their Lekas Right, and so IGN tries to promote that and encourages patients to promote that. So, if you don't have heart disease, my advice is, stay healthy, enjoy your life, and don't be too stressed, because unfortunately, I mean, there will be stress all the way, but there's always a solution to a problem, right? And has a famous quote by Jack Ma, if I recall it right? Today might be a bad day, tomorrow is worse, but the day after will always be better. So,
So
take it easy.
Yeah, so basically you have to live your life to the fullest.
Exactly.
I mean, of course, work will never, the stress will always be there, but it's how you handle your stress and how you channel your stress.
Exactly.
So I'm quite surprised that they say every day they have this like some activities, and I'm surprised they are working in a heart center, like the #1 heart center in Malaysia, and they still do have time. So that is what amazed me about IGN team.
So actually what I did was when I became the CEO, we transform some of our areas into sports centres. So we have a we have a volleyball court, a badminton court, a pickle court, netball court, basketball court, and there's an external gym right beside at the at the second floor. So I really push for people to enjoy themselves, and you can see that when it's a way to release stress. At 5:30 or so, I mean the office workers usually, they will go to the court and play, and you can see them shouting, screaming, happy lah. So I think that's the way to let go of stress, and actually at the same time you stay healthy.
True, because nowadays, as you know, sometimes if you need to go home at 5 o'clock, so in KL it will be very jammed. So might as well just change your clothes to your sports attire and just work out. It's a good way to release the stress, be healthy, and hopefully to lower your risk from getting a heart attack, right? Maybe just a little bit on the okay, I mean, like working out, sometimes some people feel that I'm not a sports person. I kaki bangku, I cannot do all these things. What are some simple daily routines or practices that Malaysians can do to adapt to lower their risk of heart disease? Sometimes people always say you have to go for 10,000 steps per day, and then you can see everybody will have their smartwatch together with them, and then but some people give some advice: when you park, make sure you park your car a bit far away so that you have to walk, take the staircase. So maybe there's a small tips that you could give for those who don't really want to enjoy themselves by playing like sports, but they still want to be healthy.
I think you said it. Walking, lots of walking. My team would know I don't usually take the lift when I go with them, and I always challenge them who's fastest as you go upstairs from second floor to the 5th floor or the 6th floor. And I think that's very important, walking and taking up the stairs. So that helps. So if you are in a building that you have to move around a lot, try to avoid taking the lifts and do the exercises. And I think that's one. And second thing is, I think with you're a desk person, that means well, every 20 minutes you should get out and walk a bit, so that improves the circulation, stretch and things like that.
How about the food? Because Malaysia is the food heaven. You have all your nasi lemak, teh tarik. It's very difficult to say no to all of these things. Sometimes their breakfast is roti canai and teh tarik, and it becomes more or less like a habit for the Malaysians. So what would you have to say for those post-cardiac surgery, or even those who wants to lower the risk?
Okay, I'm not sure I should say this, but resistance is futile, right? When the food is good, it's difficult to. But I think I'm not sure whether Tun mentioned this before when you were talking to him in the podcast, but he would say that before you feel full stop. Yeah. So I follow that, and I think that you should not overeat lah. Memang makan nasi lemak tu roti yang sedap, you know. But janganlah lepas satu lagi ke atau roti satu lagi, you know, kan. So you just control lah makan. In fact, recently I was in Japan, right, and it was a very interesting article. Japan has got obesity rate of about 4% as compared to US and UK, which is about almost 40%. Okay, but when the Japanese migrate to America, their obesity rate goes up. So a lot has got to do with food. And I was just observing when they have their dinner and lunch, right? Dia makan nasi satu mangkuk kecil je kan. I did not see anyone minta a second mangkuk. Kan kita tambah nasi lagi kan. So
sometimes they offer nasi lagi.
Yeah, exactly. You don't see that in Japan. I didn't see at all that there is a second mangkuk coming in, you know.
Okay, so I think that's the important thing. Basically, discipline. I think our previous podcast with Tun, he did not mention regarding the amount, but he did mention that he was very disciplined.
Oh, yes. Yeah. If I can just say something about Tun.
Sure, no problem.
So this year punya buka puasa, okay, and I was in the same table with him. He's opposite me, and there were a few other guys. And he nak buka lah kan. So the waiter came to put the rice, and he says no rice. So the guy beside me and I look at each other, lemak macam ni, buka puasa ni tak ada rice. So I said, okay, just satu sudu je, you know. But the point is that's how disciplined it is. Okay, and if you just look at his style of eating, he enjoys eating, not that he doesn't enjoy eating, but he controls lah. Yeah. So the key is controlling.
Yeah, even we know that even our Prophet Muhammad said sunnah is 1/3, 1/3, 1/3. You shouldn't feel like all your stomach should be like until the food is already here at your neck level, right? Okay, so moving on from our dietary post-operative care and all. So we're gonna just wanna ask from your point of view, that you have seen inside of the human heart and also literally and figuratively. So how has that experience as a cardiac surgeon changed you? Because of course you see people who recover, but at the same time also you can see death also, I mean those complicated cases. How things have changed, I mean, after all the years that you have become a cardiac surgeon? Okay,
so when you see the heart, first of all, it's a miracle. Yeah, as they say, it's God's creation, Allah's creation. So when you stop the heart and you release the clamp to restart, right, the heart will just beat on its own, most of the time. And it's something which is really difficult to understand, I mean, this is a heart that's been deprived of blood and things like that. Okay, so that's on a simpler note, because I do heart transplantation, and that's even more. When you imagine it, you take somebody's heart from say Melaka, right, put it in some cold saline and bring it back all the way to IJN, put it back on. I mean, stitch it back on to another the recipient, and heart starts again. I mean, it's very thought-provoking when you think about how it does, and so that's the miracle of Allah, kan. But the thing is, what it tells me is that when you see all this, you will appreciate that nature has been created in such a way that there's no way you can replicate lah. There's no way you can replicate. That's one. But the other thing that I would like to say is that when you see it, then you know those that have got heart disease, how you have to take care of your heart, because you don't want you to have the same problem. You see, you don't want to be under the knife with someone else operating on you, right? Exactly. Okay, so like what Dato has mentioned, I think it's very much true. Because when I was undergraduate in India, I think the first thing that actually triggers me that probably I wanted to do I wanted to become a cardiac surgeon was when I saw a beating heart, and then when they do the sternotomy, open up the chest, and I can see a beating heart just in front of me. I think that's something very much. There's no words to describe. Yeah, exactly. Yeah. So the feeling is different, but I think it's. I can't do cardiac surgery. I think after trying 4 years in cardiothoracic, I think it's people are very hardcore who are into cardiac. Maybe because you didn't get the right trainer. Okay, so we just want to talk about in terms of now
like Tun has mentioned that last time when he was operated first time, IGN was not there
That
yet.
was in
It
HKL.
was HKL. And after that, he initiated, the IGN, and now we have seen IGN is already like world class. And then a lot of cardiac surgeons have graduated from IGN. They have IGN is the main training center. But how has IGN evolved over the times? And then maybe you could share any new upcoming innovations from IGN that will shape the future cardiac.
I think in the past, cardiac surgeons were general cardiac surgeons. Okay, looking back, I used to do pediatrics. Thoracic, adult. I mean, the whole range of surgery, every single surgery there is. And then of course, now it's no longer like that. Now you either do pediatric or you do adult, and you go on to subspecialize. You can be doing aortic surgery, you can be concentrating on revascularization or valve surgery or lung surgery and things like that. So those are the changes that has happened, and I think subspecialization is good, but at the same time you have to have a very good foundation in general cardiac surgery, right? Because if you don't have that, then you would be, I would say it's almost like general surgery. When you're focusing a lot on, say, breast and endocrine, you won't be able to deal with the GIT problems or something like that. You know what I mean? If you do the subspecialization too early in your career. And in IGN, of course, our cardiology department has progressed a lot. Okay, in the past it was just focused towards angiogram and maybe stenting. Now there's electrophysiology, there's heart failure, there's sports cardiology, there is valve cardiology, and heart transplantation, mechanical heart. So there's so many things, and and because of that, the patient has got a better chance of getting recovery because there are more options now available to them.
Okay, all right. So that's the innovations that has occurred for the past decades now in IGN. Just now you mentioned regarding the heart transplant in Malaysia. I know there's only IGN who does heart transplant, right? How would maybe you could share the statistics in terms of how frequent that?
Well, there's not many. We do an average between 1 to 5 a year, depending, because we are highly dependent on donors.
Yeah.
There's a lot of patients waiting in our list, but problem is donors, right? So we are limited by that. But what helps us is that those patients who are deteriorating on the transplant waiting list, then we will put in a left ventricular assist device or mechanical heart system to support those patients.
All right, okay. So this would be little bit sensitive questions. We're talking about the training because we're done talking about the whole cardiac surgery per se. So now I want to talk about the future cardiac surgeons. So which is much more crucial, as we all know that the number of heart surgeons in Malaysia is still very low compared to the rising demand. Okay. Could you share where we actually stand now as compared to the other developing countries and other developed countries, and what needs to be changed to secure our future?
I think, well, I would just say we go back maybe about 7-8 years ago. So the Malaysian Association of Cardiac Surgeons felt that, and together with KKM, felt NIGN, if we don't do anything, there won't be cardiac surgeons around because there's nobody interested in doing cardiac surgery. So we actually worked with the Royal College of Surgeons Edinburgh to have a parallel pathway program for cardiothoracic surgery, and at the same time use the UITM also have come out with a master's in cardiothoracic sciences followed by doctorate in cardiac surgery, and that is the first cohort is already in their 3rd year, so next year they'll be in the final year. So we have maybe already about 20 plus in that group, and in the parallel pathway also about that number. So we have increased the number of trainees and cardiac surgeons over the last maybe 6 years quite a lot. And yes, we still need more, but I think we have now a bit more comfortable compared to maybe 5 years ago.
Okay, yes, because I remembered like my colleagues when I was in Serdang that time, like they are like applying for this parallel pathway with the Royal College, right? And because those days, I think during your time that you have to do general surgery first, and
Yes.
although you can do sub, that will take some time. And I think to become a good surgeon, whatever surgeon that you are planning to take, that pathway, is more of the skills that you have to continually practice. So actually, the faster you become a cardiac surgeon, I mean, the more cases that you'll be doing, so the better you'll become,
Correct,
isn't it?
yes.
So I think that is a very good initiative that Malaysia has done, that where they have the parallel pathway that they directly go do cardiac surgery. I mean, instead of probably have 4 years of general surgery, then only sub, because it's not immediately after 4 years you can straight away do
Yeah,
sub,
that's
isn't
right.
it,
Yeah,
Dato?
correct.
Okay, all right. So just for the message for those maybe undergraduates or HOs, house officers, medical officers, because nowadays we have a lot of issues, a lot of we lose a lot of our doctors no longer staying in the government. Those are were interested in cardiac surgery, like how I was before, but maybe intimidated by its demand, because like they think that it will be a long surgery, or maybe it's very tedious work to do. And it's very demanding. I mean, they worry that they don't have time for themselves or work-life balance. So maybe you could share in terms of that, and what have made you stay in this fraternity for a very long time, that makes you enjoy doing cardiac surgery day in, day out?
Because cardiac surgery is my hobby, and I get paid for it. Okay, so that's the good part. But the thing is, yes, there's no doubt about it. Cardiac surgery is a serious business, just like most other surgery. Whether it's general surgery, neurosurgery, it's a serious business. So you cannot avoid the fact that you are going to pursue a serious occupation. It's not that you're doing it for fun. So you've got to be serious about it. You've got to be passionate about it, and you must be willing to pursue the best in that career that you want. Okay, so yes, no doubt it will take a long time, but it's worthwhile. The early years of sacrifice, you will see the fruits of labor at the end of it. I know with the current generations, they want things to be done quickly. They want to become a surgeon like as soon as possible, but that's not possible. The reality, that's not possible, because it's not that easy to make an incision, correct incision, and then stitch it up correctly. So you will need time to learn. So first of all, there's knowledge. So you gain knowledge, right, by reading, by undergoing whatever kursus or master's program, and then you must develop the skills. So knowledge alone is not enough, because it won't give you the skills. So it will take time.
So it will take time. So you have to be patient, because nowadays we can see a lot of doctors, younger generation, they want it ASAP.
Instant.
Yeah, instant.
They want
Yeah.
the
If they
instant.
can't get it the first once, or second time, third time, then that's it. Time for whoever to, for them to leave, So but like Dato said, it takes some time, and you will see the yield later. The fruit will come out later after that. Okay. So to all those who are interested to pursue in cardiac surgery, there's a lot of advancements, and also the program has also changed. Now they have the parallel program. Now they have with the UITM also. So the intake will be much more easier. I mean, because last time I think the fight between the candidates itself is quite
correct. That's right. It was very competitive. But
very competitive,
I should mention that IJN has its own IJN University College, right? So we're going to also develop postgraduate programs for cardiology, anesthesia, and cardiac surgery, inshallah.
Okay, inshallah. Okay, so just don't forget to continue following IJN on their Instagram or on their website to see the updates on this. Okay, so I guess we are almost done for our session. Just before we close, maybe Prof can share beyond technology, because we have talked about the technology, about the surgery, about post-op care, and so beyond expertise, what does heart health truly means? I mean, that you could share, and what is the one message, maybe 1 or 2, 3 message also, it's fine, that you would like to share with the Malaysians to remember about taking care of their heart?
Okay, if I can just try to take you through and imagine if you have a car, okay, any car, it can be a BMW, Mercedes, or Toyota, anything, right? So you now have a good music system in the car. You've got good rims, fantastic tires, painted the car nicely, but if the engine is not working well, you can't go far. So at the end of the day, it's the heart that fuels your body to go wherever you want to go. So even if you have a lot of money and you've got heart failure, there's nothing much you can do. And the issue is you have only one heart, so you've got to take care of it.
True, because you have no other options, because heart, I mean, if there's any issues, it's not like if I would say in general surgery, abdomen, sometimes your bowel is very long, so you can actually restart it. But heart, if it's not functioning, then you don't have any options. Then that's the only one thing which is maintaining the entire of your body, right?
But if you do have heart disease, come to IJN.
Come to IJ.
Yeah.
Okay. All right. Okay. Thank you so much, Dato Ezani, for sharing such insightful perspectives. It's clear that heart health is not just a medical issue, and it's a lifestyle, a mindset, and a shared responsibility. This has been Matters of the Heart, a special podcast. It's an exclusive that we have this time. This is the first time actually we had two separate podcasts because we have two very exclusive guests. So we need a longer duration of time where we speak to those who shape the heart of our nation from IJN itself, and also the person who underwent the bypass surgery itself 2 times, which is Tun Dr Mahathir Mohamad. Okay, so remember, take care of your heart because it takes care of you. Right, so I'll see you guys again in our next podcast. Assalamualaikum. Bye.
Salam.
Thank you.